Hello, everyone. Welcome to the Urban Health Collaborative podcast, the Community Corner, where we talk about various topics around public health, education, and the creative arts. I'm Zaire Ali. I'm here to introduce you to our podcast that was produced by the members of the Urban Health Collaborative, a public health nonprofit which strives to shift mindsets and help the world believe it can be a better place. As our motto says, striving to shift mindsets and help the world believe it can be a better place. I'm here today with Kayla Tehrani and Isabel Richmond, two of our wonderful members from the digital communication social media team. We're going to learn a little bit about me, about the organization, but we're going to do it from their perspective because they are going to be leading us down this journey. So thank you so much, Kayla and Isabel, and let's go.
Thanks, Zaire. Hey everyone, as Zaire mentioned before, my name is Kayla Trani.
And I'm Isabel Richmond, and we are working with the Urban Health Collaborative this summer.
To start off, Zaire, what would you say is the mission and vision of the Urban Health Collaborative?
So honestly, we have the website that says what the mission and vision is. So obviously I could read that verbatim, but in my opinion and what I try to instill and really show is and embody is that what we do here with the Urban Health Collaborative is supposed to do is to find ways and linkages among community members, among friends and families, and just to bring them closer. Connecting parts of health outcomes, connecting parts of education, and connecting parts of just what a community and families are like. Because if we could strengthen that, if we could find ways to improve our health collaboratively and really help everyone get the best out of the education system in this country, we could do a lot of things, a lot of positive things. So that's what we're trying to just foster that and embody that through what we do, when we go out, when we have events, when we, have social media campaigns, whatever we do, we just try to show that, like, hey, it's not me, it's us, and we're really not just here to say it, but show it by what we do in the office, what we do with the community, and just how we treat each other.
How long have you been with the Urban Health Collaborative, and how did it come to be?
So, thank you. I'm one of the founding members of the Urban Health Collaborative, along with Kizra and Omar. So, it started because of a sour taste I got with the education system, the healthcare system. I was learning so much in school about people far and far away, how to, solve public health problems, but there's so much going on here, and we weren't even talking about it. So I was like, wait, I'm not going to be another statistic where it's just like I get a degree, I make money, and I go about myself. I want to be a person who directly impacts the change, be a part of the change, and help steer the change because I just believe in my why and my heart. So it's like I know I'm here to help, and I know I'm here to try my best. So it's like, hey, I'm taking these tools I have and going to really try to make change one way or another. And my way just happened to be with science, the arts, and the social science and the social aspect of things. It was founded on the principles of building community, but building community health, building community capacity, and just building within. Because if you don't build within and have a strong foundation or a solid framework to grow or to just become, I would say more whole or more sound on, how are you knowing if you're going in the right direction? The Urban Health Collaborative is just really here to try to sustain health, improve health, prevent illness. I want to discover. I want to ask questions. I want our team to investigate and bring not just science, but love and care.
What are some past projects that the Urban Health Collaborative has worked on?
The Urban Health Collaborative in the past has worked on projects around youth mental health during COVID, mental health in elderly populations, as well as trying to create our thrift store and the community corner, which is I would say, a larger project that we use and utilize to disseminate what we do, connect with the community, and really just create those bonds. So the youth project that we got funding for, that was our first project. It's called Brother to Brother and Sister to Sister, which is a youth developmental program, and we focused on high school students at first, and the goal of that program was to teach students about feelings, about mental health hygiene, and infuse all of those topics within social emotional learning. The second project was our Operation Hunger project, which was us creating a campaign to build our food pantry and to honestly just illuminate the tragedies that urban communities are facing. Majority Black and Brown communities are facing around food insecurity, hunger, malnutrition, which may lead to obesity, chronic illnesses such as diabetes 1 and 2, heart problems, and liver conditions. And the last project and the most recent project that we are working on and are in our building is a full program from K to 12, which will be two parts. One will be a program to help develop youth mental well-being, mental resilience, and just overall mental health and hygiene skills and literacy levels. And then the second component of that is to hopefully get some funding and start a pipeline program for Black, Hispanic, and other minority populations to become medical doctors or any other fields within health profession, health communication that is going to help improve the health outcomes and increase capacity of minoritized groups in the medical field. Because yes, we already know that there is a major lapse within the medical field where we have a low level and a low number of Black and Hispanic practitioners, but there's a high number of Black and Hispanic patients who are dying daily due to preventable illnesses. So through our program, we hope to build this pipeline and create this curriculum where we start youth in middle school and get them prepared and just help them understand the different professions within the medicine field and the overall health field. Because most people think, oh, let's go be a doctor, or oh, I'm going to be an epidemiologist, but there are so many more pathways to impact health positively. But right now, for that program, physicians, nurses, and physician assistants are going to be our number one priority, because we need more direct intervention in healthcare for us by us.
Yeah, that's really interesting. Looking to the future, what are some exciting projects that are in the works for the Urban Health Collaborative?
We're getting ready for the food pantry, which is Feeding Hope Food Pantry. Thank you, Replenish, for supporting us, and all of our donors. That's one. That's one. We're going to have a professional development program called the Community Closet, where we provide job coaching, resume prep, and we also give students clothes for free, and then adults clothes at a really discounted price or rental, or they just leave a deposit, but they really can't afford, just the bare minimum. Then we're going to give it to them, because we want people to exceed and succeed in life. So those are going to be two other things. And then our thrift store is going to be open regularly, which is going to help us offset asking for donations. And then lastly, we're just God willing, we get our after school program started up, so the team is getting ready to start some fundraising campaigns, and we're getting ready to write grants. So this fall, we're just really trying to actualize all of our programs and get more space, because space is always at a premium, especially in New Brunswick and in just Middlesex County. So our goal is just to maximize our funds, whatever we have, get more donations, whether it's monetary or food or just items we need to serve the community better, but also make sure or being responsive to their needs.
What can we expect from this podcast this summer?
Well, we expect a lot because we have some really amazing employees working on our podcast. So kudos to them. But what you can expect is, urban. You can expect a little bit of hood, a little bit of rich class, a little bit of Wall Street, because we are for the people. And who says that activist has to be poor? Who says activist has to look a certain way? So this summer and just for the rest of the year, the podcast, we're going to be bringing a lot of different perspectives on life, on education, on careers, and just to take a better stance and understanding of what people are doing to stay sane, but what are people doing behind the scenes that really drives them. We're going to be trying to reach out to the community and really create a space where the community can share some of their struggles, share some of their ideas, and just share some of the struggles and trials and tribulations that they might have experienced throughout life to get to where they are at this very moment.
I'm really excited to see all of it come together and to get different perspectives on what public health, what addressing mental health means, what it means to be someone who, like, through their passion for whatever work they do, how does health, both physical and mental, tie into that? In some way, shape, or form, everything relates back to each other. I feel like that gets so overlooked, and we think, oh, science is divided from creative arts. It's not. There are a lot of things that tie into each other, and I think that recognizing that, and like you said, seeing these and hearing from these individuals who are doing the kind of work that makes sure that both that all fields have some overlap, recognizing that and seeing that work and understanding how important that is something that I'm really excited to get into, especially with the development of this podcast and seeing kind of how it grows over the years.
Thank you for tuning to the first episode in the first season of our podcast, The Community Corner. We plan to bring you a lot more amazing stuff from us, from some of the communities we serve, the artists that we interact with and work with. So we're just really, really excited to get this started. We got a whole host of fascinating topics to delve into. So if you'd like to learn more about the Urban Health Collaborative and the Community Corner, check us out on internet, www.theurbanhealthcollaborative.com, or you can check us out on Instagram, TUHCHQ, or the Community Corner HQ on Instagram, or on the Community Corner's website, www.thecommunitycorner.org. Thank you for tuning into the Community Corner podcast. We hope you enjoyed our story, and we can't wait to share it with you next time. And that's a wrap!